Hello, I'm Dallas, and I'm joined by Tracy Elliott. Uh, I'm so excited to have this conversation with you. Uh, we on the podcast and just in general, we have talked a lot about new technologies, especially around direct neurofeedback or around cranial electrostimulation. And you are a practitioner of both of these.
Yes.
And you like these, but I just want to dive in real quick and just get your story. Like, how did you get into the field of mental health? What do you like about it? Just kind of those types of things.
So I grew up in a pretty domestic violence kind of household. And so when I became an adult, I got married and discovered that I was really passionate about helping people with their marriages specifically and families, because I didn't want mine to look like what I grew up in. And so, I just kept your normal everyday jobs. And then as I got older, and I mean much older, like in my 40s older, I just felt like God was really calling me to get educated. And so I began my education process, and it led me to becoming a marriage and family therapist. And so now I get to help people fix their marriages or help them stay married in some cases. I get to help a lot of people just by helping them talk through some of their stuff. So I fell in love, honestly, with helping people. And so it was a really, really interesting journey for me.
And so you started on the talk therapy, and how long ago was that? Well, how long have you been licensed
4
for?
years.
4 years?
4 years
Okay.
ago. Mm-hmm.
So you just changed. You're like, let's go. I want to help people.
Mm-hmm.
I'm gonna get licensed. I'm gonna go do this. How was that feeling of that process?
Well, that was really interesting. I worked, other jobs. Actually, I was a manager at a restaurant, but I was doing Bible studies for families and marriages in my home for many years. And so really it's been at least 25 plus years that I've been working with marriages and families. Now I do it professionally. The process was really interesting because I had never gone to college. So I started from community college and went straight through to finish my master's degree.
Wow, that is amazing. How long did it take?
8 years.
Wow.
Yeah. And I was 42, I think, when I started. So I was much older in that process. I think that was actually helpful for me because I worked harder at it.
Okay. Because you knew what you wanted to do. You're like,
exactly.
And how do you feel like that's changed? So you've gone through the education, you've gone through the licensing. How has that changed your approach? I know you can see people now, but even like in conversations and things like that, how has that helped you talk to people?
Well, it kind of helps me understand where their pain is coming from that's influencing the conflict in marriages and families. Because most people don't just argue to argue. There's usually some form of trauma, some form of abuse, neglect, and for many, it's not even intentional by their parents. It's just a adverse effect of maybe something they didn't know how to do. So I can approach it from a different perspective. I also have been married 31 years.
Mm-hmm.
So I feel like that speaks into a lot of people's marriages as well.
Wow. The experience, and then also trying to identify the things outside of it. That's awesome. And then how did you so you're doing your talk therapy, you're working through marriages. What about the technology of the direct neurofeedback? Like what was your first exposure to that?
So that's a really interesting story. The owner of our practice, actually, her daughter had migraines and kind of randomly fell into the direct neurofeedback meeting your dad, actually. And so she had done that several times, and the owner just called me one day and said, "Hey, I'm thinking of doing this. Would you be interested?" And I'm like, "Sure, I'll do a training. I'll come in and see what it's about. And so I did. I agreed to do it. But then, interestingly, going in really just having no knowledge of what it is, after doing the first training, I was like, oh my gosh, you mean I can help people physically feel some relief while we do the mental processing of all of these past traumas? I'm like, okay, this is really, really intriguing. And then once I finished it and began doing it, I probably use it with 50% of my clients.
Wow. And so 50% of your clients. So how do you introduce it to them? Like what is your process? Because you go to therapy, you're expecting just let me sit in a chair, let me go do this. What is it that you can introduce and be like, all right, now we're about to strap some stuff to your head and let's get going with this. I know it's, for me, I'm very like, I understand it. And sometimes that's not a good thing because I'm like, yeah, let's strap something to your head. And they're like, what are you doing?
Right.
But how do you go through that process?
Well, the first few sessions is typically me getting to know my clients anyway. And so I kind of gauge how severely anxious they might be or depressed or what kind of trauma might be happening. And then I might, for people with like anxiety, I just tell them, you know, I might have something that could help you feel more calm to help you think more clearly. Would you be interested in talking about it? And they'll be like, yeah. And I'm like, okay, well, this is kind of what it does. So we use this little micro burst of energy to kind of help clean out those blood vessels and kind of clean out the cache like you do on a computer. Because over a lifetime, we've collected all this yuck from our traumas and pains and hurts and things, and it can cause anxiety. Just anxiety as an example. Although it's good for many other things.
Yep.
And they'll be like, oh, okay, well, yeah, I'd be willing to try that. And I'm like, let's just give it a try, do it one time, and let's just see if it works for you. And if you feel like this is something that you'd like to continue with, we'll just add this to your treatment goals.
So you're able to do it in congruence.
Correct.
It's not something that's like, here's a separate thing. It's like, no, we're gonna still do this together. Do you feel like when you have done that, when you've integrated it into your sessions, like of course you're doing it for 50%, do you feel like you can speed up the process for them a little bit more?
I do, because I think it helps to give them some clarity of thought once we begin the treatment and notice significant changes. They're so excited about the changes that they're not so focused on what's causing their pain right away. And then once we get into that space of probably, I'd say around session 5, or between 5 and 8, roughly, then we're starting to see lasting effects of the direct neurofeedback. And so we're able to kind of talk through stuff easier.
Got it.
And they have more insight.
Do you feel like people feel it pretty quickly?
They feel it. Oh, they feel it.
Okay.
Yeah, I remember the very first training I did, and the first time I got wired up, I was like, okay, I'm not feeling anything, not sure this is going to work, kind of hesitant. And about, I would say, maybe 30 minutes later, all of a sudden it was like a switch went on and I could think clearly. And it was definitely very, very aware. And then for some people, they're like, oh, I just feel calm. So yeah, I do think it's a physical feeling in many cases for them.
So one of the things that I get asked a lot, because we go through this and they go, placebo. You're just, do that kind of effect. And I've talked to other practitioners as well. And, they're one of the other guys who was on, he's very careful about it. He's not saying, using leading words or leading things like this. What is your, response to that of like placebo effect?
Yeah. So for people who think they oftentimes will say something like, so I don't know if this is really the machine or if it's me, but I'm feeling this, this, and this. And I said, yeah, I've had that reported before too. And, we just kind of keep moving forward with it. If I get somebody who's like, I'm not feeling anything, I'm like, well, you know what? This can't hurt you. So why don't we try it for a couple
Mm,
more sessions, and if you change your mind, we'll stop, and if you want to continue, we'll continue. Usually by 3-4 sessions in, they're like, I'm starting to notice some stuff.
cool. What did you say the biggest? I mean, we talk about anxiety, and I do want to pivot also into you work with some kids in the autism space as well. What are you seeing in kind of those? You know, we've talked about anxiety, but what are you seeing in some of these other areas as well?
So the ones that I or work with most are ADHD,
Okay.
autism, and then severe anxiety. I'm also doing some work with a little bit of OCD as well.
Okay.
So the the thing that I see the most is the clarity of mind and the calm. That's the thing that gets to be probably the most physical response that's noticeable to many people. A lot of people they're not very body aware. So for them to be able to say, "Oh my gosh, I feel calm," it's pretty huge for a lot of people because they've never lived in a place of calm.
And when you see calm, I know it can be like it's not sleepy.
No,
It's just like clarity of thought, like world kind of slows down a little bit,
relaxed,
relaxed,
relaxed.
not as
Hmm.
many voice, tabs
Yeah.
open going all over the place. It's just kind of like,
Yes. Yes. That's a great way to describe it. There's not a lot of tabs open at one time.
okay. And people come to you because they go, I need help with this. I mean, I think
Hmm.
all of us all have tabs open at certain times,
Oh yeah.
but it's just learning how to control it. And the people that
Mhm.
come to you are going, I got an issue. Like
Yeah.
this is
Yeah.
causing me to have, either it's marital or,
Hmm.
job related. There's something going on. I need some outside help for this.
Hmm.
Um,
Yeah.
that's
And I use it with couples too, believe it or not. If I notice that if one person in the couple is more anxious than the other, I will do that during session as well with couples.
and how's that been?
It works well. It works well. I would love to maybe one day have a second direct neurofeedback machine to
Okay.
do both people at the same
Same
time
time. Hmm.
and then do their therapy. But right now, even working with just one person who may be more anxious than the other, it can actually um, it brings their place into clearer thinking and that more relaxed state, so they're more open to hear their spouse.
Really? Okay. Do
Hmm.
you see from that? Do you
Hmm.
see they're open to up to the house, open to hear their spouse?
Hmm.
Then do you see it play out like, oh, he or she is less, um, triggered
Reactive.
or reactive,
Yeah.
like all of
Hmm.
those types of things. Actually, the lasting part of
Yeah. Yeah.
it. That is super cool. I mean, I love that. I think what I love about these machines or these technologies is they can live in different places.
Hmm.
I mean, we've got it at Thrive when you were first exposed to it with
Yeah.
kids in the foster care system. You're using it with marriages and with OCD and all these other things. We've got another one that is used for in a wellness situation too.
Yeah.
So I think everybody has a brain and everyone has stuff that's going on with it. So it's amazing. I love hearing the stories of it. And you said, I know we talked a little bit about the autism side of it.
Hmm.
What does that look like? How did you kind of, what's been the effects of that?
So, mostly what I'm seeing when I work with autistic people is that their motivation increases, their articulation increases, and their underlying anxieties decrease. Um, I had a little boy, he was 8 years old, and just a great kid. Just not really initiating conversation, meltdowns. Young children with autism tend to have a lot of meltdowns. Um, and they just don't talk a lot about a lot of things, and so we started this process with him, and honestly within, I would say, even 5 to 8 weeks, he was leaving my room telling mom all about what we did in the office, and it was amazing. Mom was just like, oh my goodness, he's talking.
Mm,
His siblings started noticing his meltdowns decreased. He would rebound from being um, dysregulated to regulated much faster.
wow.
So it's just, to me, it's just like this. It's almost like a miracle. And I hate to even use that word so loosely, but there's just such a an effect that it has on helping brain health. It's
And they're
just
not,
amazing.
and so talk about autism, 8-year-old boy, wires.
Mhm.
How was that?
Yeah, right. Because they're really, really sensitive. They
Yeah.
have a lot of sensory
Yeah.
issues. So the way I introduce it for anyone who has definite sensory issues, I tell them exactly what I'm going to do. So I have a wire. I'm going to wire you here, 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 and here. It's not going to hurt, but I'm going to clean this with alcohol. It's going to feel a little cold. I'm going to use the exfoliant, which feels like a little sandy, and I do these little spots. And I'm very gentle, try to be very gentle with them. And then I wire them up and I say, okay, and then I'm gonna give you, I'm gonna press the button here, and and I'm talking to them as I'm pressing the button, and they don't even know it. And then the stimulation starts, and it goes through its first stimulation. And after the first stimulation, I'll be like, did you feel that? They'll be like, feel what? No. And I said, I already did a stimulation and you didn't even notice. And all of a sudden they're like, oh, okay, I can do this.
Yeah.
Mm-hmm.
That's amazing. I know
Yeah.
I think my dad does the same thing when it's like,
Mm-hmm.
he never tells you who the first one is because people think it's like, okay, is it going to shock me? Is it going to do a thing? It's like,
Yeah.
no, it's already been done. Like we've already
Yeah.
been doing it for a little while.
Yeah.
Like
We've already done two and you didn't even notice.
didn't even
Exactly.
notice. It's that trust factor going into it.
Mm-hmm. Mm-hmm.
Wow. I mean, we talk about emotional regulation. We all have our own cups that are full at certain
Yeah.
times and things like
Mm-hmm.
that. And so for a kid, especially with autism, their cups are very short
Mm-hmm.
and, they can fill up very quickly. So that is amazing. And especially the articulation too. I didn't
Yes.
realize that means,
And that is with all ages that I've dealt with so far. Even the young adult is coming out and asking mom, how's your day? And that's not common either. To be aware of somebody else's emotions or feelings or just to care.
wow,
Yeah.
that is, and so parents, I mean, 8-year-old kid, they're looking for solutions. What was their, were they just kind of like, not at the end of the road, but like, what was their journey to get into your office?
Well, I, for one, it was another therapist that I knew and was talking about direct neurofeedback. And they're like, oh, I'd love to try it then. If it can help brain health, if it can help my autistic son, let's give it a try.
Okay.
So we did.
What has been your, now talking about other therapists? I mean, you're talk therapist trained in this
Mm-hmm.
kind of trained in this field. When you bring up this technology and what you're doing with other therapists that are outside of your practice, what's their response to it?
They're very intrigued. They're not sure they believe it. They're not sure they don't believe it, but they are definitely intrigued. And I've even had some come to me and I'm like, okay, well, let's put it on your brain and let you feel it. And then you can decide from there. I actually have a friend of mine down in, I think it's Mesa, had contacted me and asking me about the direct neurofeedback and what I think. And he's like, could I pick your brain about it? And I'm like, you can not only pick my brain, you can come and test it.
Yeah.
So I'm going to schedule that with him in the next couple of weeks too.
That's great. I mean, we, as us trying to push this out to people, it's always interesting of the therapists that we run into, because a lot of them are resistant to it.
Mm-hmm.
Either it's because they have talk therapy that they enjoy, they like it, they like EMDR, that's what they've been taught, in school and everything like that.
Mm-hmm.
Another thing that was just brought up is they'll bring in other sort of either TMS is kind of one of those that's brought in, or ketamine, or these other sort of treatments.
Mm-hmm.
And it's just always an interesting thing to talk to therapists, because I think there's a way that you have to make money somehow.
Mm-hmm.
And sometimes when we say, hey, this can help your clients faster,
Mm-hmm.
people are resistant to that because they go, how am I going to make my money?
Right. But the thing that I add to mine is that there are no side effects.
Yes.
the side effects are so little, and there's no adverse chemicals, there's nothing.
Yes.
It's non-invasive.
It's non-invasive, and
And so when people hear that, they're like, oh, okay, I'm kind of willing to try that then.
Yeah, I think you're absolutely right. I think it's non-invasive. There's no chemicals. Side effects are you've got maybe a little bit of sleepiness if you get overstimmed, but besides that, it's just besides that, it's just it's a very fun tool to have. And I actually talked to another guy who runs some nonprofits here in town, or nonprofit world. I say, hey, you just hit a button and it takes the anxiety away. He goes, this is too good to be true.
Yeah. So try it.
So try it. Yes. And so that's why I'm so excited to talk with people like you, because you're doing it every day. You've got these stories that you're going, here's an 8-year-old, here's here's a a teenager, here's a marriage, here's these types of things. And that's the whole goal of this technology, is to go, all right, how do we speed this up? And the brain is something that, as you know too, there's a lot of traumas that happen that are outside of it. It's not, it's not your fault.
Yeah.
It was how you were raised. It was your parents or whatever it is. And so these are these triggers. So this is helping to regulate these things in a natural way. I mean, that's the cool thing about it. And you also understand, what I love about it too is it happens fast.
Yeah.
It's not a 6-week program and you go, oh, hopefully at the end of 6 weeks we have some results.
Yeah.
Like as you said, like how many sessions do you think you have somebody who's like, yep, I got this?
I have so many people tell me they notice something the first day.
That's amazing.
The first day, even if it's just I slept better. Even if I just felt very clear in my thinking. It's always one thing at least.
Yeah, that's amazing. So. What would you say? Oh, go ahead. Sorry.
No, I can only think of maybe 2 people that didn't notice anything.
Yeah. And how many do you think you've treated so far?
Oh gosh, I've been using this for a year and a half, and I do about 50%. I'd say, oh gosh, 50 to 75 people.
Okay, so 50 to 75 people
at least. I mean, because you figure I see them probably every other week most days.
Yeah.
If I'm using the direct neurofeedback, I see them weekly. I have a clientele of about 20, 25 people a week. It's probably more.
Well, I mean, if you could count 2 people that were like, nope. I mean, I think what we say going into it, 85% of the people don't feel something, but that's a made up number. I mean, that's just a number that we just kind of go out there and go, because I actually think it's higher. I think
it's higher too. If I go off just what I see, I would say it's much higher.
Yeah. I think it's a higher number that we feel that. And usually people, I would say too, people who are more regulated probably don't feel it as much, but your clientele is going to be more people like, hey, I need help.
Yeah.
And the more unregulated somebody is, more people that have the issues from concussions or TBIs or anything like that, they're going to be feeling it more like, oh, I'm getting some relief.
Yeah. And I work with TBI too. I have actually had quite a few clients with TBI.
And TBI from sports or
just anything? I've had car accidents.
Okay.
One person had multiple car accidents. Another one, domestic violence. Another one, I think, was sports related.
And what was their symptoms, and what did they feel afterwards?
They had a lot of headaches, pressure in their head. Anxiety was a big one. It increased their anxiety because a lot of it was trauma related. Like I said, one had 4 or 5 car accidents in just a few years. And so there's a whole lot of anxiety there.
And then how long did it take them to feel that relief?
They would start noticing change. Like I said, typically the first day they would notice something. They would notice more each time I did it. And usually, I would say it's between 5 and 8 sessions. They really notice significant changes. And then after that, they notice how long they're not noticing changes as much as how long it's lasting.
Yep. Yep.
And then, as we continue on and
Yep.
it lasts longer and longer and longer, and then all of a sudden there might be another change,
Yeah.
something like that.
No, that makes a lot of sense. That's great. Where do you see, so you've experienced this, you've gone through the last 8 years, or not last 8 years, but like you've jumped into this field. Where do you see this types of technology fitting in? Like if you were to say the future of mental health, I mean, I feel like I love talking about that because I feel like there is the system isn't, you could always improve it. I
Mm-hmm.
never want to bash it. I never want to say it's broken or anything like that. There's
Mm-hmm.
always improvement going on.
Mm-hmm.
Where do you feel like this type of technology fits in within the future of mental health?
I really think it fits in the everyday,
Okay.
the everyday client. This, I think more people need to be experiencing it too. When we can decrease physical symptoms, we can decrease a lot of the anxiety. Because most people, let's just talk about somebody who has chronic pain, somebody who lives in pain all the time. And if we can decrease that pain just a little bit, it can give clarity to mind. When we have chronic pain, our mind is almost fogged because we can't get past what we're feeling. So if we can alleviate or decrease some of the intense feelings, whatever they might be, if we can decrease them, we can do better therapy. So even on the day-to-day with pretty much any client, I feel like the more severe clients can be more helpful faster. So I feel like it should just fit in the everyday client.
I think you articulated it very well with that physical pain side of it. So what would you say to a practitioner that is interested in something like this? What would you say based off of your experience?
Oh, I would say buy it, get it, use it yourself before you use it on clients so that you know what you're talking about, first off. And then secondly, I would encourage them and say this is a really wonderful tool
Mhm.
in addition to whatever else you're going to do.
Mhm.
I don't stop talk therapy just because I'm doing direct neurofeedback. It's like, if I had a client that I was doing EMDR with, I would use the direct neurofeedback as well
Okay.
in the same way.
Okay.
So I would encourage them to try it themselves and really experience it, because I think that is where I was sold.
Mm.
Because
Mhm.
I could feel it, I saw it happen. It it gave me more insight to be able to understand what is happening, to explain it to my clients.
Absolutely. And give you that confidence to be able to
Totally.
go
Yeah.
nope, this isn't going to hurt you. It's only going to
Oh
help
yeah.
you. It's
I
going
use
to
it on my
be
husband. He's got ADHD. He loves it.
That's great. I mean, that's the cool part about it is you can pack it up, you can bring it home, you can do
Totally.
all these different things with it. I mean, we have somebody who takes it, on missions trips. They
Yeah.
go to El Salvador and they put it in their
Yeah.
backpack and they
Yeah.
go and they see these
Yeah.
people, and now the nonprofit wants it too because
Mm-hmm.
they're like, oh my gosh, I need this
Mm-hmm.
on
Yeah.
site
If
for us.
if I could help medical providers and other therapists utilize it as a tool, I would certainly encourage it.
Awesome.
I would absolutely take part in that. I would love to see people begin to feel some form of relief rather
Mhm.
than have to sit in pain all the time.
Absolutely. Where do you feel like, kind of just to kind of wrap this up, um, where do you feel like this could live the best? I mean, you talk about medical, healthcare, but where are some other places that you could see this technology living and
School,
being used? School? Ooh.
schools. Kids are so confined and anxious, and they come from homes that sometimes are really rough. If we could put this in schools to help some of those kids with their behavioral issues, it's also very helpful for people who are impulsive, by the way.
Mm.
Um, so with kids with behavioral issues, a lot of that's impulsivity. You can, offer this to them to help them educate and manage their behaviors? Schools would be great. Offices, office buildings. You're, it's kind of a similar school setting. Everybody's in boxes. Everybody's, working really hard and there's pressure. So yeah, something like that. I love that it's used for the NFL. Oh my gosh, like that's amazing. I'm hoping to someday get hooked up with that. I'm a Steelers fan, so if I could be the Steelers therapist, that'd be great.
We'll work on that. We'll work on that.
Sounds like a plan.
Because the NFL, I think NFL could really benefit from this.
Oh yeah.
College football. I mean, we've been really trying to get into college football, but again, I think the hardest part is for us has been it's too good to be true.
Yep.
I don't believe you. Like there's so much skepticism in this place where it's like, well, I've never heard of this before, so therefore, and that it is. And so it takes those building blocks of those stories of
and
going.
I'm all about challenging that.
Yeah,
I'm skeptical. I don't believe it. Well, then let's just try it.
Let's try it. Let's
try it one time. If it doesn't work for you, it doesn't work for you. But it can't hurt you, so let's try it.
Yeah, no, I love that, and I think that's where the conversation is, getting those right people in the room, just to say, "Yep, I'm willing to try this. I'm willing to go through this, do a pilot program or whatever that looks like." But it'll get there. I do believe that you are one of the pioneers of this. To go, hey, I believe there's a better way.
Yeah,
I believe that and you're seeing the results of it.
Yeah.
And that it can bring relief to people, because I mean that's the whole thing about mental health is just you're trying to break them out of this cycle, and you're not trying to let them stay in it.
Yeah, so, and that's why they're coming anyway. They want to break out of their cycle, but they're looking for relief from their pain. And so, okay, my particular field is the mental health portion, the brain, the psychological, right? But it also helps with the physical.
Yeah.
There's endless possibilities.
Yeah.
Nursing homes.
Yeah, 100%. Nursing homes,
right?
I think
special needs homes.
Rehab centers.
Oh my gosh, rehab centers would be ideal.
Yeah. Rehab centers, we've had some conversations with the rehab centers, but trying to get into it. Sex trafficking victims. It's another one.
Oh gosh, right. Oh
so
my gosh.
A lot of those types of places, but I think your story, you're using it, being there, helps propel that forward, because it's a new thing, and people are always scared of new.
Oh yeah.
And so it's like you're putting it on the brain, all these different things, but I think it's something that's going to be utilized a lot more. Hopefully, we look back in a couple of years and say, "Yep, this was something that was good for society and for people." Because it is a technology. So
and we're lucky enough that we have several therapists in our office that have been trained to use it.
Okay,
I love it.
That is how many therapists do you think you have trained?
We have 1, 2, 3, 4, 5.
Five therapists
in our office.
And they're all using it, or they're all using it in
different ways? One uses it more than the other. The other one, she's only in the office 2 days, but she uses it. The other one's kind of just starting to really get a foundation. I've been the owner and myself have been using it for 1.5 years. Literally with anybody who would let us play with their brain.
Absolutely. No, I think it's such a cool thing to be able to bring relief, and it's so rewarding too. I mean, I've been in the room with people who have experienced it, and they're like, "Oh, colors are better." You just see the physical of them relaxing more, and so it's just such a great thing. So thank you so much for your time. Thank you for talking about this. This is an exciting conversation, just to be able to hear your story with it. So I really appreciate it.
Very happy to do it. I really, truly, to the depths of my soul, believe in this product. I don't want to call it a product, because it's really more than that. It's not just a product. It's genuine help. And because I've seen how it works, I was excited to actually do that. And I'm not one to do video recordings ever, but I couldn't pass this one up.
I appreciate that.
So I'm thankful that you asked, and I'm grateful that I was able to do that for you.
Well, thank you so much. I think your story will hopefully help others
I
to
hope so.
see it and feel it and be able to go, all right, I want to take this next step. Let me ask this. Where are you, for my sake too? How can people get in contact with you? Where are you located? I'll put this in the notes and everything like that, but I just want
Sure.
to, yeah.
Freedom Family Counseling.
Okay.
We have two offices and a direct neurofeedback office. We work out of we have some counselors in Thrive. We work out of Glendale. We work out of Phoenix, and then we have an office over the direct neurofeedback office in Scottsdale. We use that too. We're able to use that too.
Yeah.
So you can just reach out to Freedom Family Counseling.
Yep. And ask for Tracy, and see what, or
Yeah.
if, contact them
Yeah.
if you want to find out more information.
Absolutely.
They are pioneers in this.
Absolutely.
I think it's just such a wonderful, wonderful story that you're bringing. And so I just thank you so much for this.
You're very welcome. You're very welcome.